We all have choices to make every day, and surely one of the most important is whether or not to have children. But once the decision is made, parents-to-be face a wide range of alternatives on how they want to bring that baby into the world. Well, tonight we begin a special two-part series on birth. During the course of these stories, we'll be showing actual deliveries because we believe it's impossible to tell the story without showing the miracle of birth. One of the things all these babies have in common is that they had no choice about how they entered this world. But their parents did. In fact, it may be the most important decision a parent will make. Having a baby is a tremendous responsibility, and today there are more options and choices available to expectant parents than ever before. As soon as a mother realizes she's pregnant, she begins making decisions that will affect the baby growing in her womb.
So she should seek medical advice early, number one. Number two, picking a doctor. Now that sometimes is difficult. I think she should ask friends. I think that's one of the best ways. You know, who did you go to? Who did you like? What did he do?
Dr. Levine also advises patients to shop around for a doctor and be sure the one you choose approves of the method of birth you want. There are many films like this one about Lamaze births, which are full of helpful information.
In our Lamaze class, we learned various ways of breathing that corresponded to the length and the strength of labor contractions.
I want to do one for 60 seconds.
All right.
Okay.
Birth can be a complicated process, and most doctors don't take the time to go into specific details, but there are plenty of books and classes which do.
All right, you have different positions for pushing available to you. You can, number one, 45-degree angle.
Not all hospitals in town deliver babies, but most that do offer classes like this one at St. Anthony's, which teaches prepared childbirth.
Prepared childbirth means that you know what's happening. You are prepared for it. Then you're more relaxed. If you don't know what's going to happen, you're going to be tight. So I'm all for classes. The more you know, the better. That's a big change, I think. It used to be the less you know, the better.
Contraction begins. Breath in, breath out, breath in, breath out, breath in, and exhale. 1, 2, 3, 4. 1, 2, 3, 4.
When these parents-to-be finish the classes, they will be better prepared to participate with their doctor in making a wide variety of decisions, like whether or not to have labor-induced, or whether to use drugs to reduce the pain of labor, and if so, which ones. They'll also have toured the labor and delivery area of the hospital and know what a fetal monitor looks like.
We got another monitor on
When Teresa Williams learned that her baby couldn't be delivered head first, rather than risk its health, she decided to have a cesarean delivery. We Americans have come to accept hospital births as the norm, but in fact, 90% of the world's children are not born in hospitals. We're often surprised to learn that our parents or their parents were born at home. Did you know, for example, that Jimmy Carter was the first president to be born in a hospital? Teresa has been given an epidural, which leaves her totally conscious but numb from the middle of the stomach on down. Dr. Marshall Mahan has carefully made an incision across her lower stomach, and soon will deliver the baby through the opening. Teresa had her first child here at Baptist East a year and a half ago. In just that short period of time, there have been important advances in the procedure, the most important of which, as far as she's concerned, is a changed attitude about the role of the father.
We were told that if a father was in the labor room, it was only there for punishment, you know, that the wife wanted him there so that he could see what she went through. And we were literally taught that.
This is a little uterine segment called the cervix. Hi, just about got your baby out. All right.
Teresa's husband, Richard, is brought in just before the delivery, something which wasn't allowed when they had their first child.
Give me a little push. Looks like we got a little girl baby. Stay asleep. That arm out. Yeah, good.
82.
Fast here because I like to get it sucked out. That is the streamer. Got your girl, Lisa. There's your baby. Your baby.
American hospitals are designed primarily to care for the sick. And although most hospitals no longer treat the mother as if she is ill, many parents complain that their deliveries seem to be performed for the convenience of the hospital and staff rather than to meet their needs and wishes.
Things are done at convenience, whether we like it or not. There are conveniences, and most of our patients like conveniences. When they go get on an airplane, they like it to take off on time. Most women, when they come into a hospital, they are going to an obstetrician who has been trained, college, medical school, internship, residency, and in practice for many years, and they realize that he is busy and he is not trying to force labor on them, but most patients I see are very happy if they can come in during the morning and maybe even be induced or brought in. I have more problems that way than I do people wanting to be left alone. Most patients want to.
Yeah.
The Caspers certainly appreciated the convenience of being able to schedule their second cesarean delivery, but they were most excited about the changes in hospital policy.
2 years ago, they didn't allow fathers in the, they performed all their cesarean operations in surgery, and fathers weren't allowed. Now they have it set up where they can perform the cesareans in the delivery room, and fathers are allowed in there, so they have a large drape up and all that, and we just got to see the baby together for the first time, and it makes it kind of special.
I enjoyed it. It was really fulfilling to watch it come. It's hard to really say what it was, but it was nice.
Fathers are permitted to attend cesarean deliveries in many hospitals as a direct result of parental pressure.
I think we do need some pressure from people to change the situation within hospitals.
In the last few years, again because of community pressure, 3 hospitals in town have set up birthing rooms.
Birth in this room is, number one, the mother never leaves this room. She comes in here, she labors, she can be up walking around in the room, she can labor sitting in a chair. There is no fetal monitoring in here. She can have her husband with her, or the baby's father, or a coach. And it's a very relaxed atmosphere because you don't have any transportation going on. Mother doesn't leave the room and has to come back into the room. The whole family unit is never separated at any time. They're always together. And that is what the families like the most.
In a birthing room, I feel that you are very cramped. It's almost to me like trying to deliver a baby with one hand tied behind you, because you may not have what you need at the time. You may have to have any birthing room.
There is no question that some hospitals in Louisville are making a serious effort to be more responsive to the needs and desires of parents. But if it's your child's birth that is affected, the changes may seem painfully slow. And according to Dr. Levine, the optimum delivery situation still doesn't exist in Louisville.
What we really need is the change in design. We need labor rooms that are designed to allow to be birthing rooms instead of designing a birthing room to be a labor room. I don't know whether I'm making myself clear, but I really think that we've taken the thing and kind of screwed it up a little bit.
Tonight we examined some of the birth options available at local hospitals. Tomorrow night in part 2 of A Question of Choice, we'll meet a family who decided to have their baby in their own home. Last night we explored some of the alternatives available to expectant parents who'd like to have their children in hospitals. But there are a growing number of couples who would like to have their children at home, and tonight we're going to meet such a couple. We're going to be witnessing a home birth, and these people have nicely agreed to let us tape that birth if we agree only to use their first names. And ladies, I will tell you once again that for all of you who've had natural childbirth, you're going to relive a marvelous experience.
Well, I want to do it, Mom.
Let's do one, then you can do one.
have Greg do one. Let me get him unstuck from the side.
Joanne is a little more than 8 months pregnant, and she and her husband Mark, like any expectant couple, are becoming excited about the impending birth. This will be their third child, and right now they just wish it would hurry up and come. For the generation of Americans who have grown up believing that hospitals are the only place to deliver children, Joanne and Mark's decision to have this birth in their old Louisville home may seem surprising. It's certainly placed them at odds with the medical community in this city.
You just don't know. Sure, 90% of maybe 90% of these patients would do fine, but how do you know which one's going to have trouble? People always say, well, they're low-risk patients. A low-risk patient can be a high-risk patient in about 30 seconds.
No doubt in my mind that the safest, best alternative in 1981 is in a delivery room.
With good nutrition and skillful birth attendants and breastfeeding and natural childbirth at home, you can, for low-risk mothers, you know, with their baby, can have their baby at home safely. It is a safe alternative.
Joanne and Mark didn't arrive at these conclusions casually. Their first child was born in a hospital, and it wasn't the positive experience they thought they had arranged with their doctor.
And then, you know, when we got in the hospital, it was kind of a different story. We had to fight for the things that we had agreed with the doctor, and the doctor wasn't there. It was the hospital personnel that we were dealing with.
After that, they decided to look for another way. Their second child was born at home with the aid of a trained birth attendant. It was such a positive experience that it solidified their feelings about the practicality of home birth.
We've taken the responsibility on ourselves that, you know, we are the ones birthing this child, and we have read extensively and trying to educate ourselves and be informed and know as much about the birth process as possible. And we have sought good, skillful birth attendants.
Get over?
No. Yeah.
3 days after the baby's due date, labor began. Mark hurried home from the office, and together they worked through the early stages of birth.
Abdomen muscles to relax.
When she has to handle a contraction, I try to make her focus on what she's supposed to be focusing on, so she can handle the contraction. With her births, she's had back labor, and I massage and put pressure on her lower back.
There will be no doctor present for this delivery, although Joanne did see one regularly during the pregnancy. This birth will be attended by 2 lay midwives. You won't see their faces, and we've distorted their voices because in Kentucky there's a fine line between attending a birth, which is legal, and practicing medicine without a license, which is illegal.
You got it. You got it. You got it.
Oh, thank you.
Yes. You did that one really well.
That was a long one.
You stayed right ahead of it.
It's also important not to confuse lay midwives, whose qualifications and experience can vary dramatically, with nurse midwives, who are registered nurses with additional training in midwifery. The state recognizes and licenses nurse midwives to deliver babies under the supervision of a doctor. Ironically, there are 54 nurse midwives practicing in Kentucky, but none working in the Louisville area. In 1975, the state stopped recognizing lay midwives and has not licensed any since that time.
The advantages of the regulations would be that the consumers could tell what midwives are qualified, and that midwives would hopefully be able to work better with the medical establishment if a woman needed transporting or had complications.
The general consensus of medical professionals is that midwife-attended home deliveries are not safe, but there are a growing number of studies to the contrary. In fact, a 3-year study in North Carolina concluded that 3 times as many babies die in hospital deliveries as die in well-planned midwife-attended home deliveries. And the findings of an international United Nations study are downright amazing. What about our mortality rate?
It's pretty bad. The United States, in the published data of last year, 1980, was 16th in the world.
16th?
16th, yeah.
Not number one like we would expect.
No, in fact, we've never been number one, ever. And in fact, 2 years ago, we were 13th. We've fallen. And the year before that, we were 16th. So we continue to go up and down, but never do we rank very high. And it's interesting to observe, if you look at the countries who have the best outcomes, that would be like Japan, Sweden, Denmark, Holland, Switzerland, countries like that. Every one of them have midwives as the basis of their maternity system, not doctors.
They say you can prove anything by statistics. I would say, without a doubt, and I think it's obstetrical belief and pediatric belief, that the city hospital deliveries in Louisville, Kentucky, or Indianapolis, or Atlanta, or San Diego, or wherever you go, are probably as safe as it can be. And I think that the infant morbidity and mortality is as low or lower than anywhere in the world.
Even though I think home birth is just the best, there are times when hospitals are necessary, and there are times when home birth people need to come into hospitals fast and have emergency cesareans. I am never saying that hospitals should be kicked out or OBs should be kicked out. No, they really have their place.
We're going to have our baby soon. A boy or a girl.
Mark and Joanne aren't concerned about statistics. They just want what they believe is best for their child. And they think the fact that most midwives have had children of their own is an important advantage.
It's a different thing when you're in labor, I know from experience, to be told by someone who has given birth before that this is all right and you are going to make it.
Am I doing good? Am I not tired?
You're doing great. Joanne, let Mark get your baby outside. Okay, it's fine.
Feels good. Feels good. I'm having my baby. Oh, gosh. Oh, I love my baby. I love my baby. I can't wait to see it.
It's coming, it's coming. Perfect, perfect. Okay, it's easy, Joanne.
Easy pushes,
easy, not hard. Short, easy pushes. That light's going to be too bright on that baby. Easy. You got it? Easy.
Oh, my God.
Want to reach down and pick up your baby?
Oh, my God.
Easy, Joe.
Oh, baby. A baby. A baby. A baby. A baby. It's a boy.
At 8:45 on a Tuesday evening, Casey Alexander was delivered by his father in his parents' bedroom. He appeared to be a healthy 7-pound, 14-ounce baby.
If birth is a family event, the mother will feel closer to her children, the father will feel closer to the family. In tense situations in the rest of their life, it may be the factor that keeps them from coming apart.
We are glad that Casey Alexander's entry into the world went so smoothly. And we hope by the time that he's old enough to have children of his own, there won't be so much controversy about what is the best, safest way to have a child.
Midwives are very concerned with good outcome for mothers and babies, and so are the physicians, and we should be able to find a common ground there.
In these 2 reports, we've discussed some of the options available to parents-to-be in Louisville. Now, we have to remember that there are no 2 births alike, and there is no best way, no one best way to have a baby. It's a big responsibility and one only the parents can decide.